Hi there, I'm Durai, physiotherapist from National University Hospital. Today I'll be taking some common questions that patients ask about meniscus tear and how to care themselves after surgery. The amount of pain a patient feels after surgery varies from person to person. Your doctor will advise you to take painkillers for a few days to week after surgery to reduce pain and inflammation. It's common for bruising to be formed around the site of your surgery, around the thigh, knee and calf, maybe 1 to 5 days after your surgery. Your doctor will strongly recommend that you take pain relief medication as prescribed for the first 3 to 5 days. You may give an ice pack to apply over operated site for the first 1 week. This is to help to reduce swelling. To reduce the swelling, the wound site, you may elevate your operated leg with a pillow. Your wound care nurse will advise that keep the dressing over your knee clean and dry. Please do not remove or change the dressing until your next appointment day. Observe for any bleeding over the wound site. Should there be any bleeding, please don't wait. Please call clinic during office hours or go to A&E after office hours. You may shower after your surgery. Sit on the stool and remove the brace. Also ensure that your wound has the waterproof dressing applied to it. Do not immerse the wound site in the water. After you have finished showering, make sure you do not twist your knee when you are getting up from the stool. The stitches will be usually removed about 2 weeks after your surgery following your surgeon's assessment. The rehabilitation starts in the ward on the same day after surgery. After you are recovered from your sedation, the physiotherapist will teach you simple knee range of motion exercise, quadriceps exercise to strengthen the thigh muscles, ankle pumping exercise to prevent deep vein thrombosis, and how to use the ice pack to reduce swelling. You will learn how to walk with the crutches, either you are non-weight bearing crutches or partial weight bearing crutches. If they are meniscal repair, they are advised to go for non-weight bearing for 4 to 6 weeks. In the first 4 to 6 weeks after surgery, you may need to attend 1 physiotherapy session per week. After that, your frequency of your session will be based on your physiotherapist assessment of your progress. You may need to attend physiotherapy session for around 9 months, but the frequency of physiotherapy session may be reduced after 3 months of your surgery. If you do not attend rehabilitation after the surgery, your knee may not get back its full mobility and your leg muscles may not gain its strength properly. This will affect your physical activities and you may even struggle to return to sports. For the first 4 weeks, you must wear the knee brace and use the crutches as per your surgeon advice. Depending on the muscle strength gained and ability to walk with the crutches and the brace, the wearing of the brace and use of crutch may extend for another 2 weeks sometime. You should wear the brace when you are walking and while are sleeping. If you are seated or lying down and remaining still, you may remove it. You should be able to walk immediately after the surgery, but in a non-weight bearing way with crutches and brace, which means no weight is applied to the operated leg. However, it may take 6 to 8 weeks after the surgery for you to be able to walk without crutches. You may do slow jog After 4 months for your surgery and following the clearance of physical examinations by your therapist, and you may return contact sports around 9 months to 12 months after the completion of your rehab program. Yes, you can resume your daily activities independently while wearing the brace and using the crutches. However, you are advised to not walk long distance or use staircase too often. If your work is physically demanding, you may not be able to return to work immediately. It takes about 4 weeks for an office worker and about 3 months for a labor worker to return to work. For the first 3 to 4 weeks after surgery, you should try to avoid some of the actions which I'm going to tell you now. The prolonged standing and walking. Number 2 is a forceful knee bending. Pivoting means twisting your knee. The first 3 months to avoid jogging and running activities. The first 4 to 6 months to avoid doing deep squats. You can resume your driving once you have achieved good knee range motion and thigh muscle strength. Usually, for your safety reason, we will recommend that you resume your driving, especially automatic cars, only for 4 weeks to 6 weeks after your surgery. Following full recovery, most of the patients will be allowed to go back to do the full range of activities that they used to do before the injury. However, some patients might find it difficult to do the deep squats and prolonged kneel down activities even after they recover. We hope this video has been useful to you. Remember to take care of yourself when you do physically demanding activities. To find out more, you can visit our website in the description below or check out other physio-related playlists in our channel. Thank you. Bye.